Have you ever felt it? That strange, persistent sensation, like there's a lump stuck in your throat, even when you know there's nothing actually there? It's not pain exactly, but a tightness, a feeling of obstruction that can be incredibly unnerving. You try to swallow it away, clear your throat, but it just lingers, often leaving you feeling worried, even anxious. If this sounds familiar, you are absolutely not alone. This sensation has a name. It's often called Globus sensation, or sometimes Globus pharyngeus. It's a remarkably common experience, and one that brings many people into doctors' offices, understandably concerned about what might be going on. Today, we're going to demystify this uncomfortable feeling. We'll explore why anxiety so often triggers it, what other factors might be at play, and most importantly, what you can do to find relief. Interestingly, the idea of a lump in the throat connected to emotional distress isn't new at all. Ancient medical figures like Hippocrates noted similar phenomena, though they were often grouped under broader, less understood terms like hysteria. Later, in the 18th century, the term globus hystericus became popular, implying it was a purely psychological issue, often linked to women. But thankfully, our understanding has evolved significantly. Today, we use globus pharyngeus to acknowledge that this sensation affects everyone, regardless of gender, and it stems from a complex, fascinating interplay between our minds and our bodies. It's a real physical sensation, even without a physical blockage, and it tells us a lot about how closely our emotional and physiological states are linked. So, why does this specific feeling, this lump, appear, especially when we're feeling stressed or anxious? The truth is, it's often multifactorial, meaning several things can contribute. Let's break down the main reasons, starting with the psychological ones, which are often primary drivers. First up, and perhaps most prominently, is the role of stress and anxiety. When we experience stress or anxiety, our bodies enter a fight or flight mode. This is an ancient survival mechanism designed to prepare us for danger. Part of this preparation involves tensing our muscles throughout the body. Think about how you might clench your jaw or tighten your shoulders when you're stressed. Well, the muscles in your throat, particularly around your voice box, your larynx, and your neck, are no different. They can become tense, contracted, and feel like they're clenching. This constant tension creates the sensation of a lump or tightness. It's like carrying a heavy backpack all day. Eventually, your shoulders ache. Here, your throat muscles are aching from sustained tension. Another psychological factor ties into emotional responses. Have you ever felt a lump in your throat when you're trying not to cry, or when you're holding back strong emotions like grief or anger? This is a classic example. When we suppress powerful feelings, especially those that naturally lead to physical expressions like crying or shouting, our throat muscles often constrict. It's as if our body is physically trying to hold those emotions in. This sensation can then be interpreted by our brain as a physical obstruction, especially if we're already feeling generally anxious. This leads us to the autonomic nervous system activation. Anxiety really kicks our sympathetic nervous system into high gear. This system controls involuntary bodily functions. Beyond muscle tension, it can also lead to changes in blood flow, inflammation, and even our perception of sensation. When this system is overactive, our throat can become more sensitive, making even normal sensations feel amplified or abnormal. This leads us to the autonomic nervous system activation. Anxiety really kicks our sympathetic nervous system into high gear. This system controls involuntary bodily functions. Beyond muscle tension, it can also lead to changes in blood flow, inflammation, and even our perception of sensation. When this system is overactive, our throat can become more sensitive, making even normal sensations feel amplified or abnormal. This leads us to the autonomic nervous system activation. Anxiety really kicks our sympathetic nervous system into high gear. This system controls involuntary bodily functions. Beyond muscle tension, it can also lead to changes in blood flow, inflammation, and even our perception of sensation. When this system is overactive, our throat can become more sensitive, making even normal sensations feel amplified or abnormal. This leads us to the autonomic nervous system activation. This system controls involuntary bodily functions. Beyond muscle tension, it can also lead to changes in blood flow, inflammation, and even our perception of sensation. When this system is overactive, our throat can become more sensitive, making even normal sensations feel amplified or abnormal.
And that brings us to heightened awareness. When you're anxious, your brain tends to be on high alert, scanning for potential threats, both internal and external. If you've felt this lump before, your mind might start focusing intensely on your throat, constantly checking for the sensation. This hypervigilance makes you overly sensitive to normal physiological processes in your throat, like saliva production or tiny muscle movements you wouldn't otherwise notice. What might be a completely benign feeling in a relaxed state can feel magnified and concerning when you're anxious. Now, while psychological factors are often central, it's crucial to understand that there are also physiological contributing factors that can either cause the sensation directly or, more commonly, combine with anxiety to make it worse. One of the most frequent culprits is gastroesophageal reflux disease, or GERD, and its cousin, laryngopharyngeal reflux, or LPR. This is when stomach acid travels up into your esophagus, and in the case of LPR, even further up to your throat and voice box. This acid can irritate the delicate lining of your throat, leading to inflammation, swelling, and yes, even muscle tightening as your body reacts to the irritation. Even if you don't feel classic heartburn, the silent reflex of LPR can be a major contributor to a Globus sensation. Beyond anxiety-induced tension, other forms of muscle tension can also play a role. Things like frequent throat clearing, persistent coughing, poor posture, or even vocal strain from overuse can make the muscles in your throat and neck sore and tense, creating that familiar lump-like feeling. Postnasal drip from allergies or sinusitis is another common irritant. When excess mucus drips down the back of your throat, it can cause persistent irritation, leading to that uncomfortable sensation of something being stuck there. Similarly, inflammation from infections like a cold or allergies can cause swollen tissues that feel like an obstruction. It's important to note that rarely other conditions can contribute. For example, an enlarged thyroid gland or nodules on the thyroid can sometimes press on throat structures. Less common causes might include cervical spine issues, certain esophageal motility disorders, or chronic irritation from things like smoking and vaping. Given this array of potential causes, it's completely natural to worry, and the biggest concern for many people is that this lump might be something serious, like cancer. This is why diagnosis is so crucial. If you experience a persistent Globus sensation, especially if it's new, changing, or accompanied by other symptoms like actual difficulty swallowing food or liquids, weight loss, or pain, it is vital to see a doctor. Typically, an ear, nose, and throat (ENT) specialist will conduct a thorough review of your symptoms and a physical examination. Their main goal is to rule out any actual physical blockages or serious underlying conditions. A key differentiator for Globus sensation is that despite the feeling, you can generally eat and drink normally without food getting truly stuck. This simple fact often brings immense relief. Once any serious conditions have been ruled out, the good news is that Globus sensation, while uncomfortable, is usually harmless and very treatable. Management is often tailored to the individual, addressing the specific psychological and physiological factors at play. A primary focus is often on addressing anxiety and stress. Techniques like deep breathing exercises, mindfulness meditation, and progressive muscle relaxation can be incredibly effective in calming the nervous system and easing throat tension. For more persistent anxiety, psychotherapy, particularly cognitive behavioral therapy, CBT, can help you understand and change thought patterns that contribute to your anxiety and the physical symptoms. Sometimes your doctor might also suggest medications, like antidepressants, if anxiety is severe and impacting your daily life.
Alongside managing anxiety, lifestyle modifications can make a big difference. If reflux is a factor, dietary changes like avoiding trigger foods, spicy, fatty, acidic foods, caffeine, alcohol, not eating close to bedtime, and elevating your head while sleeping can help. Staying well hydrated by sipping water throughout the day can also provide relief and help clear your throat. Practicing good posture and proper voice hygiene, like not straining your voice, can reduce general throat muscle tension. There are also some simple physical interventions you can try. Deliberately yawning, exaggerated chewing, and gentle neck stretches can help relax those tight throat muscles. Sometimes a speech-language pathologist can even provide specific exercises to help retrain and relax your laryngeal muscles. Finally, if there are specific physiological contributors, your doctor might prescribe medical treatments. Proton pump inhibitors, or PPIs, are often used for reflux, and nasal sprays can help manage postnasal drip. Now, you might hear some debate about whether Globus is all in your head or purely physical. This discussion highlights a core truth about this condition. It's rarely one or the other. While we've moved past the outdated hystericus label, the interplay between your psychological state and your physical body is profound. Sometimes the physical irritation from reflux might trigger the lump, and then anxiety makes you hyper-aware of it and exacerbates the muscle tension.
Other times, intense anxiety causes the muscle tension first, and then the sensation itself creates more anxiety, trapping you in a cycle. This complexity is why treatment often requires a multi-pronged approach, and why what works for one person might not work for another. Sometimes, even when reflux is present, standard medications don't fully resolve the globus, suggesting that other factors, particularly anxiety, are still heavily at play. In conclusion, feeling that anxiety-induced lump in your throat, medically known as globus sensation, is a common and very real experience. It's a testament to the powerful connection between our minds and bodies. It's often a complex interplay of psychological stress, muscle tension, and sometimes other physiological factors like reflux. But here's the most important takeaway. While it can be distressing, it is overwhelmingly benign, and there are many effective ways to manage it. Don't dismiss your discomfort, but also try not to let fear take over. The first step is always to get checked out by a healthcare professional to rule out anything serious. Once that's done, you can begin to explore strategies to calm your nervous system, relax your throat muscles, and address any contributing physical factors. Remember, understanding why it happens is the first step towards feeling more in control. Be patient with yourself, practice self-compassion, and know that with the right approach, you can significantly reduce and often eliminate this unsettling sensation. Your body is communicating with you. Let's learn to listen and respond with care.